Hello everyone. Today let's understand the murmur variations, that which murmurs increase, decrease with respect to inspiration, Valsalva, hand grip, etc. Now I have summarized all the information of this topic in a single page so that it's easier to revise. Also do enter this topic in your 20th notebook because it has been previously asked both in NEET and INI-CET. So let's understand. First we will be starting with the HOCM murmurs because this is most important. So in hypertrophic obstructive cardiomyopathy, the murmur, remember that the murmur increases when there is a decrease in the preload or there is a decrease in the afterload. So there is an inverse relation, and the murmur is increased in the condition VAST, that is in Valsalva with amyl nitrate and in standing. Now in Valsalva maneuver there is an increase in the thoracic pressure and there is a decrease in the preload. So when there is a decrease in preload, the murmur will increase. The relation is inverse. And in most other conditions during Valsalva and standing, the murmur reduces in intensity along with aortic stenosis. Coming back to inspiration. Now in inspiration there is an increase in the lung volume, also there is an increase in the venous return to the right atrium. So in the right atrium the blood volume is increased. This leads to increase in the right sided murmurs, that is in tricuspid regurgitation and in pulmonary regurgitation. These murmurs are increased in intensity. Coming second to hand grip. Now during hand grip the peripheral vascular resistance increases, so the blood in the periphery, that is in the aorta and all the blood vessels, will reduce, and this leads to increase in the afterload. That means the blood volume in the left ventricle is increased. So the conditions which cause an increased intensity of murmur seen is in mitral regurgitation, in VSD and in aortic regurgitations, the condition where the emptying of the left ventricle is seen. Also we had seen that now here there is increase in afterload, so the murmur intensity of HOCM will reduce. There is an inverse relation. Coming last to squatting. In squatting also the venous return is increased. There is increase in both the preload and the afterload. So murmur intensity of aortic stenosis, mitral regurgitation and VSD is increased, and as there is increase in preload afterload, the HOCM murmur will reduce, and in MVP there is a delayed click or the delayed click which is seen. I hope this was helpful. I'll be coming up with the second part of murmurs where I'll be summarizing all the different types of murmurs seen in all the stenosis and the regurgitation conditions in a single page. So do stay tuned. Thank you.